And here we go. Hello, I'm John Laspina, the Carnivore teacher, and today I have the pleasure of speaking with Dr. Nelson Vasquez, a passionate advocate for the carnivore diet, whose personal journey is nothing short of extraordinary. As a medical professional, Dr. Vasquez approached his health challenges with scientific curiosity and willingness to experiment. What he discovered was life-changing. Not only did he lose a significant amount of weight, but he also reversed multiple chronic health conditions that had plagued him for years. His transformation has inspired countless others to take control of their health, and his story is a powerful example of how food can be medicine. Whether you're new to the carnivore lifestyle or simply curious about its potential benefits, you're going to find this conversation incredibly insightful and inspiring. So let's dive in. How are you doing, Dr. Nelson?
I'm doing great. How about you?
Pretty good. How was that intro?
That was good.
Okay.
Thank you. Thank you for having me.
I appreciate you being on. Can you briefly share what your health and lifestyle were like before you discovered the carnivore diet?
Yes. I've been an advocate of low carbohydrate diets for a long, long time, back to when I probably read my first book by Dr. Atkins. I think
Mhm.
so many of us started there, at least in this generation, the past 50 years. And I used that as a physician because it was the first advice I would give my diabetic patients. You got to cut the carbs, particularly the sugar, the flours, the starchy foods. And I had personally used that to lose, 30 pounds, 40 pounds. Used it as a temporary measure to lose that weight. And as soon as I went back to eating the regular way, I would gain it back. But 2020, the end of 2022, beginning of 2023, I was 305 to 310 pounds. I had diabetes, hypertension, had a stroke several years before that. Uh, and I was, even as a physician, I was doing all the wrong things and then taking all the medications to keep the wrong things at bay, right?
Mhm.
And I decided I got to change this. So beginning of January, I guess, 2023 was the beginning of my current journey. Uh, I went very low carb as much as I could, lost a significant amount of weight. I think anywhere when you go above even 20 pounds is significant for most people. By the end of June, I had lost maybe 45 pounds, but there was still something missing. And in June, precisely of 2023, my daughter-in-law was pregnant with now my first and only at the moment grandson. And I went to the eye doctor to have my eyes checked. I may not have been doing it every year, but definitely regularly throughout 20, 30 years, I would check my eyes. And I had never had any major problems. And then on June 12th, I remember the day, it was significant to me. The optometrist told me, you have some macular edema, you know. And I went home and reflected on things, started doing some more research. I basically wanted to tweak what I was doing already. I mean, by that time, I had lost about 45 pounds and just wanted to tighten up the nuts and bolts, right? And started looking, and then I found the carnivore diet. That's the short story. It was actually not from a physician that I found that, but it was from Carrie Mann, from Homestead House. And I already knew there were people that follow a carnivore diet or lifestyle. At the time, I probably knew of Jordan Peterson, Michaela Peterson, Joe Rogan, but I thought they were nuts. It was weird, right? And Michaela, I understood probably a little bit more because she had gone through this personal story of multiple medical problems. So I looked more into it. I found a video by Kerry Mann. He was interviewing someone who had gone through fixed basically depression, anxiety, and a major weight loss. So then I started looking into. Then I found all the doctors on YouTube that are um, major players. They are not the only ones, but definitely most well known on social platforms. And just 2 weeks later, after the eye exam, I went carnivore. And up until that time, even though I had lost 45 pounds, my A1C the month before was still the same that it had been for a few years. And even before I was starting, I was taking a GLP-1 uh, at that time, but it had not helped me lose weight. I only lost weight after changed the diet. It had not helped me with my A1C because my A1C before I started that medication was 6.7. And the month, about 3 weeks before I had my eye exam, it was 6.7. So A1C had not changed. It was considered by medical standards under control. Okay. Interestingly enough, the only one that had told me at any point, no, I don't want it at 6.7, you need to lower it more, was my neurologist, which I see every once in a while because I had the stroke. Uh, and he was the one that actually insisted, no, you got to have it better. Everyone else was, oh, yeah, 6.7 is okay. We do know that nowadays, well, we still other doctors do, and I don't do that anymore. But other doctors will tell their patients, "Oh, if it's under 7, it's okay." And if you're over 65, 70 years of age, most doctors will be happy with an 8%
Wow.
of hemoglobin A1C. Oh, you're under control. It and it is true that the recommendations are those, but that's based on a study that was done. I believe it was the Accord study that it was done to see how effective was intensive therapy, in particular with insulin, to lower A1C. And those studies showed that if you lower by A1C on an intensive treatment with medications, a couple of things happen. Number one, they had more side effects, more mortality, and even if you didn't think that was significant, they they had a bunch of hypoglycemic episodes, and those are not fun. Whoever is listening to this, if they're diabetic, they know that when you have hypoglycemic episodes because you're taking medication, they can get really bad. And I did have one occasion where my A1C, my hemoglobin, my
Blood.
glucose got down to the 40s, and
Wow.
my family was about to call the ambulance, and I just kept telling them, just give me sugar.
Uh,
Uh, but anyways, I'm on A1C for a year and a half. Had not made a change on my A1C. Uh, being on the GLP-1, it had not held my weight until I changed my diet. For a whole year or more on the GLP-1, my weight had not changed. It may have changed 5, 10 pounds at the beginning, but then I regained them even
Mm,
on the medication. And that is a warning to anyone who wants to use GLP-1s. They cause several problems. I developed two major complications from it. One, the macular edema, which you can blame the diabetes, but I had been diabetic for 28 years, had not had any problems with it until
mhm.
I started using the GLP-1.
Ah,
And that's significant. First of all, it is on the package insert as one of the problems you have to monitor, because the GLP-1s, for some reason, accelerate that process.
hmm,
And then I had developed gastroparesis from the use of the GLP-1. It has taken me a long time to improve that. By the way, when I went carnivore, I also stopped that GLP-1. I haven't used it again.
good.
And so for the next 6 to 8 months, I lost another 55, 60 pounds.
Hmm.
My A1C quickly went through from the 6.7 to about 5.4 in about 4 to 6 months, 6 months
Wow,
at most.
that's great.
And it has stayed. The last five A1Cs I've had over the past year and a half, have basically, it's an average of 5.4.
Now, to confirm for our viewers, you were type 2 diabetic for all those
Yes,
years, not a 1. Okay.
I am a type 2 diabetic. However, when I did some labs, we're now in April, and the labs were about 16 months ago.
Hmm.
My fasting insulin at the time was very low, and my C peptide was very low. C peptide is the pro insulin molecule, basically.
Hmm.
And it when you use insulin exogenously, you don't have the C peptide portion of the insulin. So whatever C peptide you measure in your blood is from pancreatic excretion. So that gives us an idea of how your pancreas is producing. So my A1, my C peptide was very low, very low. So I did some antibody testing to see if I had any form of autoimmune diabetes, which includes type 1 and
LADA, yeah.
late
Mhm.
autoimmune diabetes of the adults, LADA, but they were all negative.
Good.
It's just after 28 years of abusing my pancreas and my body, my pancreas was exhausted. And I think that has improved. I have yet to do labs again,
Okay.
but I have been able to be without insulin on and off. There was one stretch, it was 4 months. Right now, I'm on a stretch of about 2 months. I haven't used any insulin, and my fasting blood sugars are in the 80s
Beautiful. Okay.
or 90s. They could be better. Sometimes I tell this story to some colleagues, I guess, and oh, but you're still insulin resistant. Okay, but I can safely say, by the definition of the American Diabetes Association, my diabetes is in remission. I can safely say it's been reversed. Can I claim it's a cure? Probably not, because if I went out and had the usual stuff that used to have, it would probably come back. But all in all, and trying to make a very long story short, I have reversed my diabetes. I totally reversed my hypertension. I was on two
Oh,
antihypertensives, very high dose, metoprolol 300 milligrams, lisinopril 40
wow.
milligrams. It took me from the moment I went carnivore, it took me exactly 7.5 months.
Okay.
And during that time, I tapered the doses uh, to the point that February 15 was the last time I took any medication for blood pressure. And I remember that because it's the day before my birthday, February 15th. Don't forget it, people. Just subscribe to my channel at least. Anyways, and so February 15, I got up, went to the bathroom, was coming back to bed, and I was a little bit dizzy because my blood pressure had been low, and I passed out.
Ah.
So the day before was the last time I took any medication for blood pressure, and I haven't needed it again. In fact, if I feel a little bit woozy, or I feel it when my blood pressure might be too low. I feel it, and I usually need to take some salt, or I take a pinch of salt, or put some salt in my water, and that usually takes care of it. So totally reversed the hypertension,
Mhm.
gastroesophageal reflux, nail fungus, plantar fasciitis, which I had for 30 to 35 years. I still have them in my shoes because they've been there for a long time. Some inserts because of plantar fasciitis, which can be very painful.
Mhm.
And they, the major characteristic of plantar fasciitis is it does not get better with rest. You can rest it and you don't feel the pain, but the moment you step outside the bed, or you get up from a chair, that's when it's most painful.
Mm.
After resting your foot, you try to walk on plantar fasciitis, and it's very painful. Totally gone. I don't even remember when it was gone, the pain, because usually when pain gets better, a lot of people don't realize it immediately. They just move as they would always move. And at some point, you sort of, okay, wait a second. I'm not having the pain that I used to have. 3 years ago, 2.5 years ago, I had to go to physical therapy for a few months because I was falling and I wasn't able to walk maybe more than 50, 100 yards, uh, actually 50 to 100 feet sometimes, because I had surgery 37 years ago. And even though I've done well after the surgery, I always had chronic pain and was having always symptoms of a pinched nerve, but everything was getting better. I mean, was getting worse, to the point that I was diagnosed with a spinal canal stenosis in the lumbar area with neurogenic claudication, which means after you walk a certain amount of distance, uh, you may have pain, numbness, tingling, weakness in your leg, to the point that you have to stop to rest. And I was having all of those with very little walking. So I had to, if I went to the supermarket or a big box store, I would have to get one of those electric carts, and they were not available. Which, for example, during the pandemic, you couldn't get. Sometimes you had to wait until someone came back with one because Walmart just didn't have them as available for some reason. And even after the pandemic, I will have to either have one of those or go back to the car. I couldn't really walk around much. On the better days, I could push the, the regular cart, uh, but I couldn't walk without a support, a cane, pushing the cart, or at my worst, needed the electrical cart. So all that has improved. The chronic pain has improved. Uh, I mean, little things like patches of eczema, or I had one nail with fungus that I had had for years, and I did not want to take any medications that were too strong because they can affect your liver. Uh, I was just keeping it short, trimming it, and just leaving it alone. Well, one day I'm clipping my nails, and okay, wait a second, the nail fungus is gone. Uh,
Wow.
so yeah, a lot of things. It has not improved. Um, After my stroke in 2018, I developed a Spanish accent, and I haven't improved that.
What? Say that again. That didn't improve. I didn't get it. Say it again.
2018, after my stroke, I developed a Spanish accent.
Oh, you're making a joke. I'm like, I'm.
That has not improved.
I thought I heard something about an accent, but well, if it did, that would be something to write about, right? The
Yeah.
accent disappears.
Some people complain about the carnivore diet. And by the way, any change in diet can cause some hair loss.
Uh-huh.
This was already there when I
Like
started
just like
carnivore.
mine. Yeah, we have the same barber. How old are
So
you, Dr. Nelson, if I can ask?
I'm sorry.
I know your birthday, but can you share with us how old you are?
Oh yeah, I'm 65. Last
65.
February.
Okay. All right. So 20 years ago when this all was at its peak, you were 45 years old having all these problems. That's
Yeah,
wow.
yeah. I I was probably 33 to 35 when I diagnosed myself with
Okay.
diabetes,
Wow.
because I had gotten into a habit of having. Do you remember the Mary Jane candies?
Oh yeah.
Okay.
I know all the candy.
So Mary Jane was one of my
I
favorites
love those. Yeah.
since childhood,
Mhm.
and I'm walking across the parking lot in a health center. I used to work in Massachusetts, and we shared the parking lot with a little convenience store. And I was walking across to go and get some lunch, and I was eating one of these Mary Jane candies, and I felt very dizzy. So when I came back to the center, I go to we had a little small lab in the health center, and I asked the lab technologist to please do a glucose on me, uh, and it was over 300.
Wow.
So yeah, I it's a little bit of a curse sometimes, because I've diagnosed myself with major things throughout my lifetime.
Being a physician, you tend to do that to yourself. You have the knowledge. Do you wear a continuous glucose monitor?
I do, I
Okay.
do. I have one for on and off for probably 3 4 years.
Okay.
When I was using insulin, basically I used it to keep my blood sugars down, not necessarily always to avoid eating what I shouldn't have eaten, because then I would eat something, and before the meal or after the meal, depending on the blood sugar, then I would inject myself with insulin,
Mhm.
which I didn't mention. I was using up to 300 units of insulin a day.
Wow.
So I could be able to eat, even if
Right.
it was healthy. It would be the healthy, typical food of most Puerto Ricans, which includes heavy amounts of rice and beans and all kinds of tubers,
Mm.
which we have in the island. And it's part of our healthy diet.
Mhm.
Even if you don't include ultra processed foods and pastries and all that, we have plenty of those as well. Uh, but if I wanted to keep eating the way I was raised, I needed to use heavy amounts of insulin.
Now, as a medical doctor, did you know that starch is carbohydrates, is glucose in your
Yeah,
blood.
yeah. Like I mentioned, I've been giving low carb advice, not very strictly.
Uh-huh.
I've insisted more in past few years
Hmm.
uh, with patients, but no, yes, I knew that
You knew that. Okay.
because I started doing Atkins uh, 30 years ago, 30 plus,
Hmm.
more than 30 years ago, as a matter of fact. I think early 90s. Uh, if I wanted to lose weight myself, it would be on an Atkins type diet,
So you
a low
knew.
carb diet.
Okay.
And if I advise patients, I don't, you know, we see patients that like to eat vegan or vegetarian or pescatarian, or they say they're on a Mediterranean diet. What's that? There's 500 variations of a Mediterranean diet, but uh, low carb would be always part of my advice, because if even if it wasn't the perfect diet, any diet where you eliminate ultra processed foods, refined sugar, refined flour, and anything that is made with those things, you can improve your health. Is it the best out there for you? Yeah, I don't know. I have found for me, my best is the way I'm eating now. Doesn't mean someone cannot claim that they are vegan or vegetarian, but to be vegan, and I've been vegetarian before. I've never been vegan, I think, because I never avoided eggs or fish, and many vegetarians still consider themselves vegetarian, even though they might eat eggs and fish, for example.
Hmm.
But you have to supplement heavily if you're vegan to really be healthy, and you have to um, cook your foods well, and you have to really pay attention to get the combination of foods. And there is not one food that you can eat exclusively that's going to keep you healthy. Whereas the way I'm eating, if I selected to just eat, I have a rib roast to cut in the refrigerator. That'll give me about 14 1 pound ribeye steaks.
Hmm.
Uh, I think I could do only that for a while. I've done it. I've probably gone a month here and there on the lion diet. It's excellent.
Hmm.
I'm not gonna say it's the only way to be healthy, because for weight loss, diabetes reversal, you can do it with a very low carb calorie diet along with low fat. Is it possible? Yeah. Are you going to be the healthiest? I don't know. You can do it after having gastric bypass surgery. Uh, Almost immediately, you reverse diabetes with those, by the way.
Hmm.
But it's a very drastic way to do it. If I am, and I have advised people that are considering that, well, if you're willing to go that far, why don't you try this first? A very
Right.
low carbohydrate, or just completely carnivore diet. All you're doing is changing what you eat. Please do that before you consider doing a gastric.
Such great advice, because the gastric bypass, you're taking out part of your stomach and reconnecting. I mean, that is severely. I
And
have
there
had
is,
some
for most
friends,
of
and they
those,
all had complications with
yes. Well, I
afterward.
was going to say all of those, uh, except maybe for the gastric sleeve, but
So, right.
all of those uh, have possible complications.
Hmm.
And once you do it, there's no
There's no
reversal. They can
reversal.
tell you they can reverse it, but now you're gone through two surgeries,
Right.
and it's impossible to have left it like new.
Right.
There's
Because
no
there'd
way.
be scar tissue and
There's no way
reconnecting.
it's gonna
Yeah.
be just like it was brand new.
Yeah.
So please, if you think you not need to go that far, fine. But please try something that is definitely less drastic.
Yeah.
Just give it 30 days or 90 days. If you're considering bariatric surgery, then I think it deserves a good 90 days trial.
Best advice I've ever heard for somebody. And you don't hear them saying that out there. That is such good advice. You
Yes.
talk to
Well,
Dr.
I
Dr.
am
Stivus
seeing
is a
many now.
bariatric surgeon too, and
Yeah.
I don't know if I think he talks about that too. But it's so many people just rush
Who
to
who
surgery.
who did you say?
Dr. Sivas.
Yeah,
Yeah.
he does bariatric surgery,
Yeah.
and I mean I'm saying now things that prior to maybe 3 years and back probably didn't say enough to patients. Like, how many does your doctor tell you can reverse diabetes? How many doctors say you can reverse diabetes? Because in talking to other doctors, I usually don't, unless I'm talking now within this space,
Right.
most doctors don't even say it to a patient or even know it that you can actually reverse diabetes. You can reverse probably 95% of the people that have diabetes nowadays should never have had it if they were able.
They use the verb manage. The other doctors, you have to, and the American Diabetes Association talks about managing it. You're going to always have it, and it gets worse, is what they teach.
And
And
and I can
it's
tell
not
you that
right.
I can tell you I am proud to say, because may yeah, I thought I was helping patients, and the lower you keep your blood sugar, the better you're gonna be. But I used to be an expert at managing diabetes with all kinds of drugs.
Right.
Okay, there's about 10 to 12 different groups of medications, and I know how to use them all, the side effects and all that. Well, I don't use many of them, or probably most of them anymore. Not me even prescribing them to patients. No, let's start here. You can do it. I am, as far as that's concerned, I'm nothing special. I did it. Uh, where do I have my? Oh, it's far. Okay, I I've done it, and there is no difference between me and my patient in the room as far as whether they can do it or not. You can reverse your diabetes.
Now, do you tell your patients your story to tell them that, I did it, this is how I did it, and now you can
Yes,
do it?
yes. And I usually, I'm gonna have to reach for this. Give me just
Go ahead.
1 second.
All right.
All right. Well, you have seen this, but I keep this. I graduated from medical school 40 years ago. And whenever I see patients, I always have my white coat.
White
Thus,
coat.
yeah, I could have a polo, jeans, and sneakers on, but I put my white coat.
Okay, your
Coat,
white coat. Okay.
my white coat when I go. Yeah, that's the stroke gave me the Spanish accent. Uh, uh, I always see patients with my white coat, and I always had in the pocket of my white coat
Oh, yeah, that picture. Yeah.
my picture,
You sent me that. I'm going to use that for our thumbnail. Yeah.
and that there has been me for most of my career.
Wow.
I am back now at my weight when I got married. I am back now to part of my high school, and I say part because during high school I did lose some weight at some point, and also during medical school. But basically, I am back to a point in my life where I had spent already many years of my adolescent years, teenage years, my early 20s, and but most of the rest of my career has been that bigger guy. And that
Yeah.
bigger guy was using 300 units of insulin,
Wow.
large amounts of antihypertensive. I had a stroke. My triglycerides were always high. My HDL cholesterol was always low. I had never had it in my, I had never reached 40, never had a blood test that showed HDL at least 40. Always had been either in the 20s to the 30s. So when I had the stroke, by the way, I was diabetic. My triglycerides were high. My HDL was low. My LDL was a little bit high, but LDL cholesterol by itself is not a significant cardiovascular event risk. However, when you have it in conjunction with high triglycerides and low HDL and diabetes and
Mm.
hypertension, is a bomb. It's a ticking bomb waiting to explode. And it did explode to me,
Mm.
for me. Uh, I have reversed. If we talk about the markers of metabolic syndrome, which is the uncontrolled, well, it's high blood pressure, blood sugar, waist circumference, triglycerides, and HDL. I had all five.
Mm.
I am down to one, and that's basically the waist circumference because I still have more around the waist than I should. We're working on that. We're all a work in progress.
That's amazing. There's so much to unpack here. I had like 10 questions, but I wanted you to continue talking. Let me go back to my question came into my mind a little while ago. We talk about how you changed and healed yourself by just changing your diet. So, and you talked a little bit about, what you ate as a Hispanic and so what are you, and you talked a bit about cutting up your rib roast. What are you eating these days for, you have one meal a day, two meals a day, and what do you eat?
Most days I have one meal a day,
Okay.
and once in a while I have some salmon. Today I had salmon,
Okay.
but I I buy all cuts of beef,
Hmm.
and it could be from a rib steak, ribeye steak, or I mean anything I can buy. I Depending on how lean it is or how fatty it is, then I might cook it differently. If it's a tough cut, usually we'll just put it in the crock pot, or slow cook it at low temperatures in the oven. So sometimes I've bought brisket or round roast or rib roast, or I've bought every cut of beef, including cheek meat.
What is that?
Cheek meat usually it's used for barbacoa.
I don't know what that is.
The cheek of
Oh,
the
the
cow.
cheek meat.
Cheek.
Okay. Oh, I've heard of tongue. I have not heard of cheek meat.
Yes,
Huh.
I don't know if I eaten tongue, but I was surprised to see it this week. Very expensive.
Is it? Oh,
I don't know. I didn't think it was the cheek meat. What I bought it for three something a pound.
all right. Okay.
Uh,
Where do you
so
shop? You're a Floridian as well, so I'm curious where you get your beef.
so I have two companies I mail order,
Okay.
and then if I'm mail ordering, probably will order something that is grass finished.
Hmm.
But I also go to Walmart, and I go to Walmart, go to Sam's Club, and there's a couple of Spanish restaurant supermarket in the area that I go to, depending on prices and what I'm looking
Right.
for. I also buy fat trimmings,
Hmm.
beef fat, And this particular supermarket, they sell it to me for 99 cents a pound, but they normally throw it away.
Right. They should give it to you.
And so I went this past week, 2 weeks ago, I went to the supermarket to buy the rib roast. By the way, I paid 8.99 a pound.
Not
And
bad.
this is the regular price, by the way.
Wow.
They never put the rib roast by itself. They just cut it themselves. They are into steaks.
Mhm.
And unfortunately they trim the fat and
Right.
but so I bought it that way, and I'm gonna cut it. And what I do is dry brine it, put sometimes put it up to 3 to 7 days to dry age in my refrigerator. I've experimented with all kinds, and then I buy burger patties or ground beef. I make it into patties or use the ground beef to mix it up with eggs. Whether I cook the eggs before into the ground meat or sometimes after, and they mix it.
Hmm.
I try to vary it a little bit. We do eat chicken in the house.
Okay.
Uh, Used to be my favorite, of course. I realized what my favorite was. For example, going to Popeye's Fried Chicken
Mhm.
or Popeye's Kitchen or Louisiana Kitchen, whatever name is there right now. But I soon realized that it was the flour, the fried flour, and the the way they make it, not the chicken itself. So I still like chicken. I still eat it, but it's not doesn't make me crave chicken anymore. Whereas I can crave a little bit of a piece of red meat.
Hmm. Okay. Um, if you could go back and speak to your former self before starting carnivore, what would you say? To like, if you could do it over again, would you do anything a little differently?
So, John, I am a fan of time travel movies.
I am too. That's interesting.
Okay. So, and Back to the Future, for example, which are my family's, not only me, my family's favorite here are the Back to the Future movies, and we've watched the three movies multiple times. And of course, at the moment, we don't have that technology to time travel, but I have also learned all the things that can go wrong with you when you try to mess up. But the hypothetical question, what would I tell myself? I would tell myself as soon as even if we go back 33, 34 years, as soon as I read my first Atkins book, I would tell myself to pay attention, to read it 10 times, and to
Ah.
put it into practice, not only for myself, but for my patients. I wish I could go back to my teenage years and tell myself, or even go back to my childhood and start telling my mother,
Mm.
who was a diabetic and hypertensive and became morbidly obese in her 30s.
Hmm.
And I wish I could go back and save her life because she was a nurse and she followed doctor's orders. Okay. I think, and I'm not complaining about this being a doctor, but sometimes we follow blindly what your doctor tells you and don't question the authority and don't question the science. We were talking on Kit's podcast, his 5 a.m. Meet up every day
Mhm.
this week, and we were talking about the science. And I said, well, questioning the science is the science. And we have totally lost, especially in the past 5 years, we have totally lost that mentality. The science, first of all, is ever changing. We keep finding new things, and we discover that things that we thought were one way, yeah, yeah, they're actually not. And all of a sudden, 5 years ago, this global thinking that the science is set in stone is it's incredibly wrong. Number one, because when you read the definition of what science basically includes the fact that questioning the science is the science. So I always mention I like to teach. I've taught medical students, I've taught residents, and I like to teach the medical students more. Okay. When you're teaching a resident, they already think they're knowing know it all, at the moment. It takes a long time to feel confident, by the way. But the students are more receptive, and if they don't learn anything from me, I like to think that at least they learn one thing: always ask why. If you have that attitude when learning, and you're a teacher, retired teacher, but you'll be a teacher until you die,
Yeah.
right?
Hmm.
And don't you like it when a student, they can be pesky, they can get under your skin sometimes, those students that are always questioning you, but that's the way to learn.
It is. And I was that student. I drove my parents crazy and my teachers and professors crazy. And as a teacher, I loved those students, even though sometimes they didn't ask the questions appropriately or respectfully. Deep down, it took us in directions in the classroom and tangents that so many wonderful doors were open and discussions happened because of those questions. And the kids walked out learning things that I didn't plan. And I get the chills right now talking about it. That's, education. We're all, you're a doctor, so you're a teacher. Being a teacher to me, you hit that on me, is my passion, and always questioning, always asking. Absolutely.
And definitely, I always say, if I prepare a lecture, who is the one who learned the most when you give a lecture? Usually it's you.
You did, who prepared it, right?
Well, you prepared it to be able, yeah, they're gonna benefit, and the better you do, the best.
Right.
If you do the best job you can, you're gonna teach some people some things, but you always learn more than anyone listening to
In
you.
the preparation and the act of trying to communicate it, you're going through more of your own five senses, and yeah, it pushes it in. You learn so much by having to prep. That's a good point. That teachers learn a lot when they prep and teach. Absolutely true. Yeah, interesting. A question that I didn't get to ask you a little while back. I see that you only do OMAD normally. So you do intermittent fasting because that's basically what OMAD is. Um, do you do any extended fast, any long-term fast, or have you
Yes, I
benefited from
have.
it? Okay.
So as far as the eating, I try to eat the one time a day, try not to snack on anything.
Hmm.
If I snack, and I don't call it a snack,
Hmm.
if I'm really getting hungry,
It's another meal.
it's another meal. Now it might be a much smaller than the. I usually don't have two large meals,
Okay.
uh, but most of the time it's only once a day. I usually like to eat in the mid afternoon, my once a day meal.
Oh, so what time do you normally eat in the day?
Mid afternoon to,
Like,
let's say, anytime from now. Today I did it earlier because I wasn't here, and I was rushing to come back for this,
thank you.
uh, but I did eat around 12, but most of the time it'll be between 3 and 5, 3 and
Oh, okay.
6.
3 and 5.
I'm
Good.
trying to also avoid eating at nighttime,
Hmm.
because the more distance there is between your meal and your bedtime, and your time in bed, the better your numbers are going to be in the morning.
Hmm.
Now, there are other people that, for whatever reasons, time flexibility or preference, they like to eat later at night and then they go to bed at some point. As long as you're that's fulfilling your goals is not causing you any problems, that's fine too.
Okay. So do you do 2, 3 day fasts ever?
Yes. So November 2023, the answer is yes. And
Mhm.
I've done anywhere between 1 day and 5 days. 5 days is my
Wow.
longest.
Hmm.
Uh, 1 day, I had never, ever fasted for more than probably 12, 16 hours. Never, until I started carnivore. And 3 or 4 days after I started carnivore, I got up. I was not hungry. And from the first moment in the morning I got up, I knew I wasn't going to eat that day because there was absolutely no desire to eat.
Interesting. Yeah.
So I skipped that day eating. And the next day I ate because I essentially scared myself. I said, wait a second. Maybe I could have gone another day at least. But anyways,
It gets easier, right? Your body, it
yeah.
absolutely, yeah.
But then end of October 2023, again, I diagnosed myself with something not very nice. I got up to go to the bathroom. It was dark, but I could still see what I was peeing was red, was
Ooh.
gross hematuria is the term.
Hmm.
And I had no pain. If you have a stone, you know it, right? Because it's very
Uh,
painful. But not, no, I was having what medically is painless hematuria. And I learned in medical school and throughout the years, painless gross hematuria, it's cancer until proven otherwise.
oh.
Yeah. So when immediately had my urine checked, there was blood, had a urine culture, was negative, which means already there were no signs of a stone, there were no signs of an infection. So I called the urologist, was getting a hard time making an appointment. Yes, we also go through that. Uh, Nowadays, to try to get your specialist
Right.
appointment is
Even you have problems with that.
so. I arranged for my own imaging. I had an MRI with and without contrast. Of course, it showed a tumor in the bladder.
Oh, wow.
Okay. So, long story short, about 20 days later, I had surgery. It was the week of Thanksgiving. So, I celebrated that Thanksgiving about 2 or 3 days after surgery. Uh, it was pretty painful for a couple of days. And it came out to be a malignant tumor, cancer.
Wow.
So, I had it removed. Then I went through the treatments. I did the routine treatment, uh, which was weekly sessions, once a week for 6 weeks. And what I did was, among others, I contacted Dom D'Agostino. I contacted Thomas Seyfried. I tried to contact another doctor. I'm not going to mention the name, but another doctor that also talks a lot about keto and cancer. And oh my God, I couldn't get a hold of her. Of
Hmm.
her, I just mentioned her gender, but uh, took me 8 months before I was able to talk to her, and I was all over done with the treatments. But anyways, what I'm driving at is I put into play Dr. Seyfried and protocols, the post press uh, therapy, and I added about 7 supplements that are glutamic, and I was checking my ketones, trying to stay in ketosis, and I incorporated fasting 2 days before and 2 days after my treatments. So I would eat, my treatments were always on Wednesdays. I would have my last meal on a Monday and not eat again until Friday. If I ever, a couple of times, I was hungry enough and I didn't want to eat, I would count that day as a fasting mimicking diet day, and I would have maybe 500 to 800 calories. Yes, calories is not a real thing, but it's what most people understand
Mhm.
when we talk about amounts of food, right? And so I either completely water fasting or a fasting mimicking diet day. I did that 2 days before, 2 days after. So one meal on Monday, my next good meal will be Friday. I did that for 6 straight weeks. And after that, I've done, try to almost weekly do a day of, like yesterday, I was fasting. I ate Sunday, and my next meal was just now. Uh, and today we're recording on a Tuesday.
Mhm.
So 48 hours or so. I try to do that every week. The week last week, previous week, I had done Monday, no, Sunday to Thursday. So I had a 4-day fast. Occasionally, I've done a dry fast, either just the day or I think the longest I've gone on a dry fast has been about about 36 hours or something.
Wow. Wow. Now, testing ketones, how high have you been able to get your ketones?
Well, back when I was dealing with my
Or the
treatments,
what is the ketone glucose ketone index, which is what you're really looking for,
yeah.
right? That number.
So the index, I've had it as low as 1,
Okay.
but the amounts of ketones, I think the highest I've had was about 6.5,
Wow.
which is very high.
Yeah.
Now, among other things, while I was doing those treatments, and I think I should mention that after my treatments, I've had 3 cystoscopies, 1 CAT scan, multiple urines, and everything has been negative.
I was going to ask you what have the results been of all of this?
So,
Good.
but I was also using exogenous ketones.
You were adding. Okay.
So I know through my fasting, definitely low carb, I was already producing enough, but I wanted to be on a high level of ketosis.
All
So
right.
um, actually, it's harder for me to get into those high levels now. At the time, I think I was also using MCT oil. So MCT oil, exogenous ketones, low carb, lots of fasting. I was doing everything.
Right.
Uh, and one thing I wanted to do, but I couldn't do it because I couldn't find a place, was hyperbaric oxygen therapy, which is one of the many things
Hmm.
that are part of the protocol. I wasn't able to get a sauna either. Uh, but, anyways, I was doing everything I could. So it's harder to get into ketosis for me right now, into high levels of ketosis.
Hmm.
I can get, I think, past few months, the highest I may have had is 1.5. So zero point 0.5 to 1.5, I try to stay there, but very often, even if my blood sugars are in the 80s, my ketones might be 0.2, 0.3, 0.4.
All right. And the tumor is either not growing or shrunk or
No,
because of all of
the
this or
tumor was gone with the surgery. It has never come back.
all right, so the surgery took it out, hasn't all right, excellent. Now the press pulse, what was I'm curious, I don't know all the details. The drug that suppresses the glutamine is because I've heard that some of these are unobtainable right now.
So the
S-
most the most famous drug, which Dr. Seyfried mentions a lot, is Don, and I
Right.
forget what the DON stands for right now, but it's Don, and that was taken off the market because of
Right.
severe side effects and all that. But I found a list of 10 actually supplements
Hmm.
that had some level of evidence that they were uh, glutamase inhibitor. So m- some of these things included turmeric, NAC, sour sub, and anyways, I think green tea. I have a list somewhere of 10 of them. I was using 7 out of that list,
Hmm.
and those I was using usually for 3 days after the treatment. So the press part includes the ketosis and the
Hmm.
low carb,
Right.
and the pulse part is heating your body with these additional therapies like the hyperbaric, the anti-glutamic uh, supplements. There are certain drugs that have had some anti-cancer properties, and some of them, of course, if you mention them, people get.
You're right.
But there are several of the anti-parasitic
Right.
medications that have some value. There's some evidence, like the mebendazole and the ivermectin, and uh, I did not have any of those, but there is some evidence that they're helpful. I happen to be on already on 3 medications at the time that also had some anti-cancer properties, so I continue to use those. But yeah, I sort of put my own protocol together based on the work of Dr. Seyfried and Dom D'Agostino and several other people that have worked with cancer, and everything goes back to Dr. Warburg's
Right.
discoveries back in the 1920s and after that.
Dr. Nelson, we're out of time, but I could talk to you for 4 more hours because you went through things I didn't even think to ask about and shared so much. And I hope that our audience takes away something they did not know, because I certainly learned a lot more about you by just letting you talk. Like you and I, we've spoken many times on other interviews and live shows, but this was fantastic. So much to learn. I'm so glad that you're healthy and you're doing well and you look great. And I hope I get to see you in person again sometime soon. Can you tell us where we can find you online?
So if you look for Dr. Kilt's channels,
Hmm.
particularly in the morning lives or Sunday mornings, or if you're part of Dr. Kilt's group on Mondays, you have to
Hmm.
be a member of Kilt's Mighty Tribe. Go to drkiltz.com and you can sign up for free.
Hmm.
And because I am now working for Kilt's Health.
I should have worn my kilt shirt. I have his yellow, his orangey yellow shirt. I'm wearing this one though
Yeah,
from
no,
yeah,
I'm working uh, also with the people of Healing Humanity.
Carrie. Yeah.
So very often you find me on their Zoom calls there all the
All
time.
right.
Uh, but I am the medical director for Kills Health. We're trying to put more content out, uh, and I am traveling with Dr. Kills to many of the meetups and the meetings across the United States. Right now, I'm going to be in Tennessee and Yuma, Tennessee, and in Meatstock 2025. There's no tickets that sold out.
Right.
I'm going to be in Seattle, in Boston. I'm going to be in San Diego in August, here in Orlando in August as well. Uh, if Dr. Kiltz is there, I'm going to be there
All right.
most of the time. And in San Diego, if anyone is listening, San Diego, Dr. Kiltz is going to be a speaker. We're going to have a booth. And we have a 20% discount if you want to sign up for Low Carb USA San Diego. And the 20% discount is very easy. It's Dr. Kiltz. That's it. DRKILTZ. And that gives you 20% discount to the Low Carb San Diego event.
All right. And that's Symposium for Metabolic Health, correct?
That's the title of the symposium.
Low Carb.
It's sponsored
In
by
San Diego. Yeah, I went to the one in
by
Boca.
Low Carb USA and by the Society of Metabolic Health Practitioners.
Excellent. And do you have a YouTube channel? Are you on
My
Facebook?
YouTube channel is at The Real Dr. Nelson.
The Real.
And, you know.
Is it? All right.
And it's a variation of all those in the other platforms.
All right. So Facebook,
Instagram,
okay,
TikTok. I'm trying to arrange I have a channel on Rumble, but I don't have any content there.
Right.
But in those other ones, it's either at the Real Dr. Nelson, or it might have my last name, The Real Dr. Nelson Vasquez.
All right. Is it spelled DOCTOR or just DR period?
DOCTOR.
It's DOCTOR.
Yeah.
All right, Dr. Nelson, fantastic. Any last words you'd like to share for our viewers when they watch this video?
Get healthy. I think any which way you can. And if you have to use medications, I'm not against medications, but I think you can do it without medication. You can certainly you can reverse diabetes, hypertension, liver disease. We didn't even talk about fatty liver.
Oh, yeah.
But you can do it. Do you have to make some changes? Like Dr. Kiltz sometimes says, life is hard sometimes, right? And you have to maybe make some sacrifices. Because I've had people tell me, I cannot give up my bread or my pasta.
Right. I'll never give that up, they say.
I've literally had multiple people tell me, I'd rather die.
Right, I've heard that.
Okay, well, you're going to get your wish. And
right.
Listen, we don't know when we're going to die. I could die tomorrow from something. And of course, if it's a heart attack or a stroke, a lot of people are going to say, oh, well, he was eating all meat. But I think I'm healthier now than if I had not made the change. So if I live 1 year or 20 years, so my father lived 92, his mother lived 93, his grandfather lived 100. If I make it that far, great. Whatever time I have, I want to be the healthiest.
Right.
And I'll be fine with that.
Thank you, Dr. Nelson. Stay online here when I end this so I can give you another proper goodbye. And leave comments, folks, at the end of this video. And I think Dr. Nelson will probably get back to you, and I will get back to you too. We read the comments in YouTube. Take care. And
Bye-bye.
Don't leave yet.